Kneeling down on the ground doesn't have to be painful, and I'm going to show you how. You're going to need a few pillows or simply something to boost yourself up. You're going to place the pillows in a way that allows you to straddle over them, so one knee is basically directly over the pillow. And then you're simply going to do a normal lunge, or basically kneeling down to the ground with those assisted pillows. And as you can see, when we do this variation, you're boosting yourself up, so you're just not going down quite as low. You may be thinking, Logan, well, I want to bend down to the ground. I'm not always going to have pillows there. Well, the idea is that we're trying to strengthen the connective tissue, which would be your tendons and ligaments, in addition to your muscles, to get you stronger in that top position. So the second you get to the point where you can do that one with ease, you can take one out and you can go a little bit lower. So then you're like, hey, maybe someday I'm feeling strong enough to the point where I can then go all the way down without even doing a thing. In addition to this, you can also take the balance aspect out of it by holding on to something. I have a walker here. You obviously don't need a walker to do this. You can grab a piece of wood like so and use that as kind of like a cane, or simply hold on to something as well. When you take the balance aspect out of any exercise, you are able to focus much more on the actual movement itself, because balance is usually in a lot of these kind of complex movements. If you think about it, the second I hold on to this walker and then I do those assisted lunges or those assisted kneels, I only need to focus on the muscle movement. Obviously, with time, we want to be able to try to do this freestanding, so then if we fall down when we're outside walking around, or if we just want to get off the ground because we're playing a sport and want to get up better, we won't have those opportunities. But when we're still building our leg strength and building the connective tissue strength in our knees, hips, and ankles, these assistive devices are a really good option. And especially if you're somebody who's a little nervous when you're doing these exercises, if you need to hold on to something like this to begin, by all means, please do. But remember, the purpose of doing all of these movements is to hopefully over time get rid of one of those pads or pillows, get rid of that assistive device, do it without it, to the point where you will be kneeling pain-free, multiple repetitions, doing lunges until the end of time.